old cap. Yes.
And I've never had the caveman reaction either.
That's good.
So
No, your face looks good. Now, when you switch needles every
Pretty much
area
switch
that you
every
work
area. Yeah, and the reason I
Okay.
do that is the fresher the needle, the sharper it is, the less it hurts. And obviously that's the goal, is to make this the least painful as possible.
on? Sure.
Okay, so I'm going to have you turn your head this way for me. And smile real hard. Let me find that muscle. You can see the edge of the muscle pulling up right there. Relax. So we're going to get just a couple little spots along the side here. You have to learn to sort of visualize where the muscle is, and that's where you want to put the Botox.
Right. Well, you've already got a little indication when she smiled, so you follow the contours and then.
Mm-hmm. And again, everybody's anatomy is a little bit different.
Right. I think Kelly
Squint
smiles
for
a
me like
lot
the sun's in your eyes. Squint.
and easily, so you can find it.
This little injection in the arch of her brow is going to give her just a little bit of a lift in the brow there, which most people really like.
Mm-hmm.
Do you notice a nice change when I do that for you?
yes. The brow?
Yeah.
Yes.
Good. Smile again for me. And relax. Good. And you can tell that, this is not really bothering her a great deal. It's pretty easy. It's pretty quick. She's usually in and out of my office in less than 15 minutes. We'll stay out here on the edge so we don't get too close to anything that will bruise. Good.
Yeah, it's pretty direct, but it's still involved.
Mm-hmm.
Got to have somebody that knows what they're doing working on it.
Right.
It's good.
So that's pretty much it. I mean, that's how long it takes to do a full treatment.
When does she expect to see results?
Full results are going to take about 10 or 12 days. I usually ask people to give it a full 14 days before we decide if they need any more treatment.
Don't forget that brow.
Oh,
I've been doing this.
thank you. She has. Okay, squint for me one more time. Thank you.
Yeah, got to get matching
You got me
arches.
nervous here on camera. Okay, good job. Good job. Glad you're watching me. Keeping
No,
me
that's
honest.
I've noticed the last couple of times we've done this, the rapport you have with their patients, they can tell you.
Yeah. Well, I think it's really important to involve them.
Right.
Make sure they know exactly what they're getting, why they're getting it, why it works, why we're putting it where we're putting it. Smarter patients just make better patients. They're easier to take care
Hey,
of.
that's great. Yeah, we'll use that as a tagline.
Okay. Thanks, Kelly.
You're welcome.
Yeah, thank you both for that. Very informative.